What if I told you a group of young activists once took over a hospital in New York City and forced the system to change how patients were treated? I'm Dr. Michael H. Ford, and I'm here in the Bronx, where in 1970 the Young Lords staged the historic Lincoln Hospital takeover. This is a story you need to hear. At the time, Lincoln Hospital was known as the butcher shop. Patients described dirty conditions, infections spreading from unclean equipment, and even surgical instruments left inside people after operations. For the mostly Black and Puerto Rican families who lived in the Bronx, it wasn't just a hospital. It was a symbol of neglect. Infant mortality rates were 3 times the national average, and deaths from treatable conditions happened far too often. One of those preventable deaths was Carmen Rodriguez, a young Puerto Rican mother. After she passed away during what should have been a routine procedure, her community said enough is enough. The Young Lords, a Puerto Rican activist group inspired by the Black Panthers, decided to act. On July 14, 1970, at 5:15 in the morning, about 150 members and allies walked into Lincoln Hospital and occupied it. Their message was simple: healthcare is a human right. They demanded no cuts to services, faster completion of a new hospital building, better training for staff, and community center programs. Things like door-to-door testing for tuberculosis and lead poisoning, a daycare center for patients' children, and addiction treatment rooted in dignity, not punishment. The takeover lasted 12 hours. For much of that day, the hospital was not run by administrators or politicians. It was run by the people. The Young Lords met with hospital leaders, city officials, and the newly created Health and Hospitals Corporation. By 4:30 p.m., they reached an agreement. The occupation would end, but community health programs led by the Young Lords would continue inside the hospital alongside medical staff. Their legacy was enormous. The Young Lords helped spark the creation of the Patient Bill of Rights, a standard that says all patients deserve to be treated with dignity, respect, and informed consent, no matter their race, income, or insurance. They exposed how deeply inequality shaped health outcomes in the Bronx and forced the nation to see what happens when poor Black and brown communities are left behind. Even today, research shows Black and Latino patients with diseases like colorectal cancer face worse survival odds than white patients in the same city. Funding gaps for hospitals in neighborhoods like the Bronx remain stark, but the Lincoln takeover proved that communities could organize, push back, and demand better care. This wasn't just a protest, it was a fight for life, and it reshaped healthcare rights across the country. Healing starts with knowing. Follow for more.